Judy Shoemaker is not your average grandmother.
I am a professor. I teach doctoral research for several online universities and have a lot of hobbies and a lot of interests. I'm married. I have 2 grown children and 2 granddaughters. One's 9 and one's 3. And they keep me quite busy. And obviously, I have dogs. I have one therapy dog, and this is Charlie. He's right here. And we're part of Therapy Dogs International. Therapy Dogs International is the largest and oldest therapy dog organization in the world. We have over 96,000 dogs and handlers nationwide and internationally. Our jobs are providing emotional support. They also are very, very good we do reading programs with children. We work with autistic kids. We work with memory care, Alzheimer's, and Charlie and I actually do a lot of work with hospice.
Her dedication to her family, students, and therapy dog organization was unwavering until a car accident in December 2014.
I used to think whiplash was something that people made up to get out of work, to be very honest with you, until I saw my back.
The pain affected nearly her entire body.
Both legs all the way down. My left foot would not function. I had to lock my foot and swing it through, radiating pain down basically every direction on both sides of my legs. My lower back was very sore. I had numbness in both arms, and here, very severe pain in this area, and then the pain going up and over my head. So I was functioning on about a level 7 to 8 all the time.
Like many others, Judy tried various pain management techniques.
We went through all the pain management. I did 6 rounds of pain management injections with no improvement. I have a chiropractor. He did everything he could, and then the relief that I did get was from my acupuncturist, who would treat me several times a week just to keep pain under control. You can only live so long functioning with a pain level of that high all the time. I wasn't sleeping because it would keep my worst time is always at night, and so I wasn't sleeping. So when you're not sleeping, that makes it even worse. And so everybody's saying, "You really are in pain." I'm fine, But that was the best I could do.
When traditional methods of pain relief failed, Judy did what she does best.
How did I find Bonati? I found Bonati by doing my research. All right, I'm a research professor. This is what I do. So I started looking at alternatives. I did go to another Laser Spine Institute, and they basically told me that from the MRI that I had, I might have one disc that needed to be fixed, but that they really didn't see that was anything more than that. I knew from my research that my pain was definitely going in more directions than just that one disc. I went to a local neurosurgeon who I couldn't get past his PA, so that never materialized. And so I just decided to make an appointment with Bonati, and I looked and I realized that because he was the one who founded the procedure, that it was probably best to go to the source. You tend to go to the best person that you can find. So that's why I chose to go to Bonati.
Bonati Spine Procedures are custom tailored to each patient and performed one level at a time to address the source of the pain, targeting the most painful areas first.
Show me where you hurt. Yep, that's right there. And so we had a treatment plan like that because my pain reflected what he saw in the x-rays and the MRIs. And that is a very unique procedure. The doctors and the staff actually listen to what the patients are telling them.
Within minutes of their procedure, patients are up and walking in the recovery room, and in most cases, back to work in just a matter of days.
Let's go to work. We have had amazing recovery. We come back to the room, go back to the hotel. I put myself back, I take a nap, we put myself back together, and we go out to dinner. And I walk. We have to walk a lot. So I walk 20 to 40 minutes the day of surgery, after surgery.
Now she's back to enjoy quality time with her grandchildren and, of course, Charlie.
I'm more active with my dog than I was before because there was a point which I couldn't lift him. And I'm teaching my 3-year-old granddaughter how to swim this summer. That's been an experience. I do a lot with my music. I do a lot with sewing and things like that. I think I value my health and my well-being much more than I ever did before. It's really a phenomenal experience. I can't encourage people enough. I pass out cards like crazy. My acupuncturist has a stack of them.
Judy has witnessed firsthand the success of the Bonati Spine Procedures.
I've seen people come in wheelchairs, bent over, and the next day in clinic are walking for the first time in months. That's miraculous. it's really miraculous. They give their people their lives back, because pain, you can manage, you can live with a level 3 or 4 if you have to, but you can't live with a level 7, 8, 9 on a daily basis and not have it wear you out. From the moment you hit the door, you have a feeling that there's hope. It's not like walking into a traditional doctor's office where everybody is, well, we have to do this, and everything's, they take their jobs very, very seriously, but it's a very uplifting facility. And, everybody knows you, and you have the same team. This is, I think, what's so important for people to know, is that you have the same team that you meet the first day that stay with you until you're done. Those people know you. They know how you react to anesthetic. They know they know what veins to work. I mean, that sounds silly, but they know what veins and which arm is where they should go after for the for their IVs in pre-op. They know how you react to the anesthetic. They know that your blood pressure is usually this, and so if it's not, and especially in recovery, they know that this is how you recover. So if there's something out of the ordinary, they spot it like that. And that's what's very, very unique. They're wonderful. They're just really wonderful. But that familiarity, that camaraderie is something that I think is quite unique.